Hi, everyone. Rochelle here, and Dr. Dana Philisaint welcoming everyone back to another episode of MindCare. Now, today is an absolutely fascinating topic, so you definitely want to stay tuned. And today's topic is how to cope with the trauma of the sudden death of a loved one. So now this series we've been discussing dealing with childhood trauma and its effects. This podcast aims to provide hope and answers and take away the stigmas of childhood traumas. Dr. Dana Philisaint is a professional counselor whose focus is on childhood traumas. Hi, Dr. Dana Philisaint.
Hello, and welcome to another episode of MindCare.
Yeah, fantastic. So today, like everybody or almost everybody has dealt with this, and today's topic is how to cope with the trauma of the sudden death of a loved one. So how should we even first approach this topic?
And, as I'm thinking about it now, this is the year of the COVID. I mean, so many people have lost loved ones, and even for those who died this year of other related situation or a health situation, the first thing I can say is just whoever's listening, this is your situation right now, that you are experiencing a loved one's death. We want to say that we're sorry that you're going through it. And whatever your feelings that you're experiencing right now, they're completely valid. Death is not something that we were made or created to experience. And so the pain is deep, and there's no words really that can express the feelings that you're going through right now. And so we really, really send our condolences to you. I heard once someone mentioned it this way and expressed it this way, that after they lost their loved one, it's like losing an arm or a leg, and there's not much they can do except trying to figure out how to adjust their life and learn new ways of navigating this world. And, it's a hard time. It's definitely a hard time. And so we're truly sorry, and just know that to our listeners who are experiencing this right now, that we're sorry and that we're praying for you.
Now, you talked about some of the feelings and emotions that some of our listeners may be feeling if they're going through this type of trauma. So, and we all know we grieve differently, but can you talk about some of the common feelings that people grieving may experience?
Mm-hmm. And you said it too. We all grieve differently, but the common ones are things like a shock, feeling that they're disconnected from their feelings, or from even other people. They just shock, in that mode of shockness. Another one is disbelief, feeling of numbness or belief that there's been a mistake. This person cannot have died. Or helplessness, a lack of knowing what to do to relieve themselves of this pain, or even regret, feeling that they missed out on saying something or doing something perhaps, or guilt, even feeling that maybe they should have done something to prevent this, that could have prevent this death, or anger about the situation, about the person leaving, or sadness, crying frequently, or, grieving in general. It's really hard on anybody. But there might even be some physical impact on the individual, meaning they have a hard time sleeping, their appetite might change, they lost energy, focus, concentration they might have some difficulties there as well. And so those are some of the common ones that we hear that people experience, or, me myself, after I lost my grandmother, I remember some of these feelings as well. So those are some of the common ones.
Okay, I know you talked about the different feelings. So I know this might be an odd question, but what if the loss was a sudden death? Are the feelings the same, or are there some differences?
Well, there might be some similarities there as well, but the idea is that, you're never prepared for death. But in a sudden death, when a person leaves you without even, there's no indication that was going to take place, you feel almost vulnerable. So examples of sudden death would be like an accident, or terrorist attack, or murder, suicide, or going through an acute medical condition such as, heart attack, or even witnessing certain deaths, of someone that you weren't expecting to see that. Thinking military, I used to work for the military. So things like that, those sudden deaths, you your feelings are all over the place. You might feel one way one day, and the next day your feelings might change. And there might even be a delay of grief reaction because you're trying to comprehend what just took place. Or, you stay in that shock stage for a much longer period than you can even consider. Mm-hmm.
Okay. Now, in this time, where the big thing that we're talking about now is mental health. So is there any links between experiencing the trauma or of an unexpected death of a loved one and mental health? Is there a link between those two?
Well, there is some studies that were done, but one in particular I remember in 2014, they wrote an article entitled The Burden of Loss. And the burden of loss, unexpected death of a loved one, psychiatric disorder across a life course in a national study. That was the name of the study. They looked and surveyed, they actually did a structured interview of adults, 27,534 individuals, and they asked them various questions. What they found was actually very interesting. They found that amongst all the trauma that people can experience, this one is actually mentioned as the most severe. They rate it as the highest, the worst experience ever, and it's common amongst anybody who even experienced other trauma. And the emotions that's connected to this type of loss is devastating, and their response was very strong as opposed to other types of losses. In general, the studies show that there was a strong connection or risk, higher risk level of adulthood, childhood, for those individuals who experience that type of loss, sudden death of a loved one, of experiencing major depression, panic disorder, maniac episode, phobias, or even the use of alcohol might be an increased rate. So in other words, there's a risk, a higher risk for those individuals who have lost a loved one to just unexpected loss in connection with different types of mental health concerns might come up as a result.
Okay, so you talked about some of the, sorry, go ahead.
That's it. That's pretty much it, that there is a higher risk for those individuals to experience it. It doesn't mean that they will, but their risk level was higher.
Okay, so you talked about some of the risks. So I'm sure maybe our listeners are probably wondering, and this would be the next question, is when is it necessary to seek help and talk to professionals?
Okay, so for public health, this is definitely a concern when they see that there's an elevated risk for individuals who experience sudden loss, unexpected death of a loved one. But in general, if an individual does not have that social support, if they lack social support, or they're going about the grieving process in a very unhealthy way, and when I mean an unhealthy way, I'm talking about they're contemplating, hurting themselves or contemplating hurting others, or they're trying to figure out ways to numb their pain with the use of various, substances. It can be alcohol or whatever. So those kinds of things, or even if there's a prolonged grief reaction, those individuals, I would say, definitely it would be very beneficial for them to seek out help. But as we've discussed in previous lectures or previous conversations, it's not necessary for everyone because grieving is normal. Grieving is definitely a process that people go through when they experience a loss of a loved one. So, and for that reason, there are many people who are very resilient. We talked about that before as well. They have a strong faith and they believe, they have an understanding of what death is, or they have a meaning to it, and they know that death is not the end. So those kinds of things. So for those individuals, if they have that social support and they have that resilience and they have that a normal response to death, which is grieving, and it's not necessarily that they need to go and seek out professional help. But for some, it might be definitely something that they need to consider.
Okay, great. So whenever we talk about grieving, there seems to be this awkwardness with family and friends because, as friends, it's like, what do you say? How do you approach this? So, for those of you who are listening, if you have a friend who is grieving, what is something that, we can do?
Okay. So to do list, I would say this. Be a good listener. Be genuine, And when you say that you're going to pray for someone, actually do it. Pray for them. And find out ways that you can help them on their daily tasks. For a coworker, for example, maybe you might be able to carry out the task that coworker was carrying that they still need to carry when they come back or something. Expect that they're going to have some emotional ups and downs. Realize that things would never be the same with that person. So they might have a shift in perspective in life. What was important to them and meaningful before might not seem that important anymore. It might be very trivial now. Be willing to accept that person that it is a terrible thing. Agree with them that it's a terrible thing, that it's not fair, that it's a sad thing. Just agree with them with that. And then, of course, check to see how they're doing, even months after their loss. Just because time passed doesn't mean they stop, thinking about the situation. So allow that person the time, of course, that they need. And they might be angry. They might feel guilty. It might seem that way. But just don't take anything personal. Expect that the changes will take place with that individual. And they might feel distant to you or, somewhat needy. Whatever it is, realize that when you do care about someone who has lost, it is very painful. And so even for yourself, as you're, trying to help that individual out, or just by listening, you might be going through issues yourself. So be prepared that some of those things of your losses in the past might come back up. So prepare yourself as well to go through a somewhat grieving period as well. It's very normal to see yourself going back and remembering this loved one that you lost. So make sure you're taking care of yourself as well in the process. And I would say don't be afraid to bring up the issue too. A lot of times just because the person's not thinking about it doesn't mean that they stop talking or thinking about it. So it's okay to talk about that loved one with them as well.
Okay, great point. And so what is something that we should avoid doing or a friend should avoid doing or saying, around a person who is grieving?
That's a good question, too, because there's a lot of assumption of how you think the person should be feeling or behaving. So I would say the number one thing is don't assume anything. Don't assume that you know how they're feeling. Don't assume that you know how they should be behaving. So just be available and open to whatever they need. Again, is avoid expecting the person to return back to normal on a regular schedule, Avoid expecting the person to follow any social norm of what you believe a bereavement is. Sometimes we read so much we think that this is the phase that they should be on and they should be on this phase next. And, grieving is different for everyone, so don't expect anything or avoid thinking that you know. Avoid confident statement like, time will heal all wound or, it's all for a reason. Wow. Those things, you want to save that. That's not the time for that. And another thing I would say, avoid taking it personal if you see that the person is, perhaps rejecting you for some time or whatever, but don't take anything personal. Avoid, skipping around the issue of loss because you think they make the person too sad. So, again, the person is already thinking about it. If it's a loved one that they lost, it's in the forefront of their mind. So it's okay to talk about that individual. It's okay to, bring up conversations that might bring the name of that individual that passed away as well.
Wow, those are some powerful points, Dr. Dana Philisaint. I know this was definitely a very important topic given, the environment that we're living in right now. So thank you for that insight and helpful information. And for our listeners, don't forget to visit mindcare.us for resources and additional information.
There's one other thing I forgot to mention as well. Can't believe that I forgot. But the tips, what are some tips that people can do, take away for ways that to cope with the situation? One thing I would say is be considerate of your feelings. Be willing to share your feelings and your thoughts. So if you're going through a bereavement period right now, do share it. Find ways to share your thoughts with others. Spend time in prayer is so important. God is one that truly understands. And so you can pour out your anger at him. You can yell. You can scream. You can cry. He wants to hear your thoughts. Stay close. Pay close attention to, how you're feeling emotionally. physically as well. If you're feeling sick or so forth, make sure you seek out help if you need. Journal your thoughts is another important aspect that you can do, and create ways to remember that loved one. That's another essential component of tips that you can take with you. Another, last but not least, I would say, is read Scripture, especially text that reminds you of the second coming of Christ. You know, I found it very beneficial to remind us that this is not the end. And so things like Revelation 1, verse 7, that reminds us that Jesus is coming back in a cloud, John 14:3, that he's going to prepare a place. You know, the book of Thessalonians, it talks about how, you know, we're going to all be caught up in the air with God again, you know, and there's so many reminders in 1 John 3, verse 2. So those kinds of things reassure us that, you know, there's hope. So I would say read on the second coming of Christ and what does it mean that Jesus is coming back or that we might see our loved ones again. Those kinds of things are very assuring in Scripture for those individuals. So those are just some tips I would say that individuals can you know, consider as well.
Very important. So those are actionable things that you guys can actually do and put into place. And again, this podcast aims to provide hope. And so hopefully anybody listening out there, for those of you who are dealing with this, hopefully this podcast has provided hope for you and also, you know, things that you can do. So definitely don't forget to visit mindcare.us for resources, and don't forget to like and subscribe. See you on the next episode.